morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by my team, Dr. LaQuandra Nesbitt, who is the director of D.C. Health, and Director Chris Rodriguez, who is the director of DCH-SEMA. Today, we will provide a response, an update to the district's response to COVID-19. I want to start by acknowledging that today marks 1 year since we first declared a public health emergency in the district. And I want to say thank you to the team of DC government employees from all across our government for your efforts. I want to thank our healthcare workers and first responders, community partners, and all Washingtonians who have sacrificed so much to save lives, to stop the spread of this virus. I also want to continue to show our daily metrics. You will notice that one of the numbers is much higher than it has been, and I think we've already discussed with you a backlog that was reported, I think yesterday or 2 days ago, that will appear in the 7-day average over the next several days. So that's why you see an elevated number there. We follow a level of community spread, health system capacity, public health system capacity, and community engagement across several metrics. Yesterday was also a big day in terms of our continued vaccine rollout. We launched our new pre-registration system. The launch went very well, and by 8 p.m. we had more than 77,000 people pre-registered for vaccination. I want to thank Octo, our CTO Lindsay Parker, DC Health, and Dr. Nesbitt and her team, and the partners at Microsoft who helped make this a successful launch. So we want to say a little bit more about what we know about our registrations. So let me just go over a little bit, and this is as of a certain time. What time is it? 8 p.m. last night. This is as of 8 p.m. Last night. So DC residents in priority zip codes who are 65 or older, about 1,300 registrations. 65-year-olds from any DC zip code are just over 2,600 registrations. DC residents in priority zip codes who are 18 to 64 with qualifying medical conditions are almost 12,000 registrations. DC residents in any zip code with a medical condition between 18 and 64, about 32,000 registrations. DC residents, priority zip codes who are in an eligible workforce are 2,818 registrations, and members of an eligible workforce, regardless of home address, are just over 9,300 registrations. And more than 33,000 people also registered who are not eligible yet. As we talked about on Monday, the first appointment invitations will go out to people who pre-registered. Those invitations are randomly selected according to the priorities that we've indicated. About 40% go to seniors over the age of 65. In priority zip codes, and the other half, all DC zip codes. 40% go to people with qualifying medical conditions between the ages of 18 and 64. One half in priority zip codes, the second half in all DC zip codes. And 20% go to eligible workers, one half to priority zip codes, and the second half without regard to zip code. Approximately 13,500 invitations will go out this week. Anyone who is registered by 11:59 p.m. p.m. tonight will be a part of that randomized selection process. So in other words, all of those numbers I just mentioned to you will change throughout today, and we hope that they do. As a reminder, if you receive an invitation to book your vaccination appointment, you should respond to that invitation within 48 hours. And the first invitations go out
tomorrow morning.
Tomorrow morning. They go out on Friday morning. We also want to clarify that if you indicated a vaccine preference when you filled out the questionnaire, that response does not affect when you receive an appointment invitation. At the moment, those responses are just being shared with our vaccination program team for data collection. And please remember to check your emails. You have 48 hours to respond and accept the invitation. Of course, we continue to get people pre-registered. We also have a number of special initiatives where people may be vaccinated. And here are some of the Faith and Vaccine Initiative locations. Our faith-based partners will be reaching out to congregants and community members to get eligible neighbors registered for the clinics. So you can see upcoming locations at the Temple of Praise in Ward 8, Union Temple also in Ward 8, Greater Mount Calvary in Ward 5, First Baptist of Minnesota Avenue in Ward 7, and the Pilgrim Rest Baptist Church also in Ward 7. We are also encouraging everyone to become a vaccine buddy. While we're pleased with our registration system, we know that you have to be in it in order to get scheduled for a vaccine. So we continue to ask neighbors and friends and pastors and cousins and nieces and nephews to check in on our senior neighbors. Post a pic of the senior and you on your social media. Help your senior loved one register at VACCINATE.dc.gov and help us by spreading the word and using the hashtag WEAREDC. Dr. Nesbitt will want me to also remind you that your healthcare providers and local clinics also have a vaccine. So if you are in these eligible groups, your providers may also be able to serve you. So now let me turn it over to Dr. Nesbitt, who is going to talk about the CDC guidance and recommendations that came out earlier in this week. And I'll leave it at that and turn to Dr. Nesbitt.
Thank you, Madam Mayor. So we are excited to have our first conversations about what fully vaccinated individuals can do after they have been fully vaccinated. What it means to be fully vaccinated is we know that it takes about 2 weeks after you receive the second dose of a 2-dose series of vaccines, so the Pfizer and Moderna products, or 2 weeks after you received a single dose vaccine, so for example, the Janssen and Johnson & Johnson product. The full vaccination means that your body has now had the appropriate amount of time to respond to the vaccine and begin to produce antibodies that can protect you from infection in terms of the severe disease and hospitalizations that we know these vaccines can prevent. So the CDC, as the mayor mentioned, released guidance earlier this week in terms of what fully vaccinated people can do. We'll be incorporating that into DC health guidance for individuals, and we'll publish on our website in the next day or two. So fully vaccinated individuals can visit with other fully vaccinated people indoors without wearing masks or physical distancing. That allowance is related to private gatherings. Visit with unvaccinated people from a single household who are at low risk for severe COVID-19 indoors without wearing a mask or physical distancing. And then they also, and we've talked about this before, have the opportunity to be exempt from quarantine and testing following known exposure if they are asymptomatic. If anyone ever has symptoms of COVID-19, they should isolate immediately and be tested regardless of their vaccination status. So we'll have some graphics that will help people understand what it means to be vaccinated and what you can do right now with the first set of guidance that we're providing to fully vaccinated people. Again, we expect as we get more information about the vaccines and their ability to reduce the risk of spread from person to person, we'll be able to make other recommendations for fully vaccinated people. We'll first talk about fully vaccinated people and their ability to visit with other fully vaccinated people indoors in private gatherings without wearing masks or physical distancing. This recommendation means that people can visit without masks in private gatherings if everyone is fully vaccinated. So both people or all people from all households. We also want to note that at this time, DC is still recommending that indoor gatherings not exceed 10 people. Next, how does a fully vaccinated individual engage with an unvaccinated household where people may be at higher risk? If a fully vaccinated person visits a person at increased risk of severe COVID-19, and we explain what that is in our guidance, so individuals over the age of 65, individuals 18 to 64, or even younger who have a qualifying medical condition, because we want to be mindful of our children who are medically fragile and have special health care needs. Everyone in that environment should wear masks, even the fully vaccinated person. And social distancing will still be necessary, and we would still encourage you to have those visits outside when practical. Next, we'll talk about what fully vaccinated people can do with visiting people from multiple households. So the best example we give here is that a fully vaccinated woman visits her unvaccinated cousin, and then the cousin happens to have a friend over from another household. So now you've got 3 households mixing. And regardless of the health status or risk for severe disease of any of the unvaccinated people, everyone should wear a mask and social distance and practice good hand hygiene as part of those visits. And again, it would be preferable to continue to have those visits outside where practical. So next, we talk about visiting unvaccinated people from a single household, which takes into consideration that the unvaccinated individuals are not at increased risk for COVID-19. So a fully vaccinated couple comes over to have dinner with an unvaccinated couple, and none of them are over the age of 65, none of them have qualifying medical conditions, then it would be appropriate for them to remove their mask and to have limited social distancing with those 2 households. Next. So now we just want to make sure that we emphasize that while fully vaccinated people have some additional things that they could do, it's still critically important for fully vaccinated people to take the same precautions as everyone else when out in public, such as wearing a well-fitted mask and physically distancing from people. We're still recommending that fully vaccinated people avoid medium and large-sized in-person gatherings, both in private spaces and in public spaces. And then everyone should get tested, as I mentioned before, if they are experiencing COVID-19 symptoms, regardless of their vaccination status. Next. Thank you.
Thank you, Dr. Nesbitt. And let us just turn to some quick updates, also COVID-related, because yesterday the Congress approved the American Rescue Plan, which is huge news for our recovery and also for the nation's recovery. We are very happy that DC was made whole. We've talked quite a bit about the $755 million we were shorted in the CARES Act. and we are grateful that the administration and the Congress corrected that. Second, we want to thank the President for visiting W.S. Jenks in Ward 5 on Tuesday. The first and second families have already shown that they are committed to be active members of local D.C. I got to visit with the second gentleman, I guess also a couple of days ago, in Ward 1 at a Ward 1 establishment, Hook Hall. So we were very happy that they are embracing our city, county, state, almost 51st state. So of course, the president was speaking about small businesses and what the American Rescue Plan, how the American Rescue Plan will help businesses come back. And he highlighted the Paycheck Protection Program. So you can find out more by going to pppready.com, where we explain to DC businesses how to navigate the Paycheck Protection Program. In the last round, DC businesses were able to access $2.2 billion in 2020. So we want to make sure that we do it again. Next, we want to make sure that everybody is paying attention to parking regulations. We are beginning parking enforcement in the district. I've asked DPW to focus on several areas, but you should expect, as we have more activity in the city, full parking enforcement will resume at some point. We want to make sure residents know that we are resuming parking enforcement for vehicles violating no parking signs in school zones. Warning tickets will be issued starting next week through the 19th. And during this period, no fines will be issued, but cars will be located. And beginning March 22nd, $25 tickets will be issued to those violating the school zones. And let me just give you also a reference of what types of what parking enforcement is being enforced. No, do not park in school zones. Do not park in non-commercial vehicles illegally parked in commercial loading zones. Do not park large vehicles 22 feet and over illegally parked next to recreational park, school, church, or residential domicile. Do not commit safety violations, such as vehicles illegally parked in or near bike lanes, crosswalks, fire hydrants, etc. Stay tuned, because while the following remain suspended, we will switch on enforcement of the following in the near future. Emergency no parking violations, expired district license plates and inspection stickers. That one is going to come much later. Expired residential parking permits and expired meters. So those are our updates on DPW. So we are happy to take your questions. Yes, sir.
At what point will DC be encouraging all residents to pre-register?
28,000, is that the number you told me? Or 33,000 who are not eligible to register, or who are not in an eligible group have registered. So people are doing that, and they can do it. We, however, are focused on those people who are eligible for appointments right now.
And I don't have the stat handy, but is the number of vaccines that were reserved for seniors through the portal, does that exceed the number of seniors who signed up?
So today, we want to make sure that we keep people mindful of this is the first day of people registering. There's still the full day today for people to register, and our senior vaccine buddies will be out in the community today. And we're also asking everyone else to be a senior vaccine buddy in order to ensure that we have the maximum number of seniors registered, not just this week, but in subsequent weeks, so that we can, as our highest group people for severe disease, group of people who are at risk for severe disease, hospitalization, and death, we can focus on getting as many of them registered and vaccinated as soon as possible.
Obviously, Maryland a couple of days ago relaxed numerous restrictions around capacity. Is there any thought about how their decision-making will influence how things go in the district in terms of our recovery?
Well, we are a region, and Maryland has sometimes done things at the state level that hasn't amounted to much change at the county level. And it's the counties that surround us that where we have the most concern.
Would the decision at the state level by Maryland have any influence on our plans for easing restrictions or reopening in the coming weeks?
We've already mentioned to you that we will take a mid-month look at restrictions, and then we'll do more as the spring happens. So we expect to talk to you on Monday about some loosening of phase 2 restrictions. Yes, sir.
I'm Alberto Pimienta with Telemundo 44. Right now, when people go to register in the website, in the new website that was launched yesterday, there's language there that says that some documents are going to be required when they go to their appointment. For a lot of minorities, it's very hard sometimes to get these documents. So what's your message to them? If they don't have those documents when they show up, are they going to be able to get the vaccine?
So we always encourage everyone to have, as you know, both many of DC's residents are insured and have health insurance. So we encourage them to bring that information because it helps many of our partners who are offering vaccination be able to receive some type of compensation for the work that they're doing and hire all of the staff that they've hired to support these efforts. The vaccine, of course, is free. There's no out-of-pocket cost for any individual in the district or any of our eligible essential workers. We do ask that people do their best job at verifying their own identity when they registered. And this helps us to ensure that we are vaccinating, actually getting doses into the arms of people who we've considered to be at the highest priority for vaccination at this point. It's one of the ways that we have to be able to control people transferring their appointments to other individuals, et cetera. So people are highly encouraged to provide those documents. And it does not necessarily have to be a driver's license or a state-issued ID. For people who are registering as an essential employee, they may be asked to provide some type of proof of their essential employee status, which could be their work badge, it could be their paycheck, et cetera. Otherwise, we could simply just have everyone signing up to say that they're an essential worker in certain places as a way of trying to move ahead of the line before the general population becomes eligible.
What if they don't what if they don't have those documents?
Yeah, so I appreciate the question that suggests that anyone who is registered in these priority groups would not be able to validate their priority, but we know that that likelihood is very low. We've been doing this now since December 14th, and we have had in practice, including at our specialty clinics that focus on individuals who have English as a second language, and many of our outreach workers, that they are not in practice encountering people who cannot produce anything that supports their eligibility. But people will not be turned away.
Just one more question. What's the status of the website existing in other languages at this point?
Sure. So that is a question we'll have to confirm the exact timeline with our technology partners. One of the things that has to settle, and we've done a lot of testing this week, are the different phrases and language, the language that's actually used, because every time you change any word, then it has to go through the translation process for all of the subsequent languages. But it is a high priority for us here in the district.
Yes, Mark.
So if I could just clarify.
And I'm sorry, if I can add to that, the call center, anyone who calls the call center, though, they have access to language services through using that modality.
So if I could just clarify, you are asking for proof of eligibility for essential workers, but not for medical conditions?
So yes, let me be clear on that. An individual attests to their qualifying medical condition. They are not required to go to their doctor and to provide any proof, to bring prescriptions or anything like that that supports a medical condition that they've attested to. We already know that this will be the largest group of eligible individuals of any of the phases until we get to phase 2, which is with the general population. After we've moved through all of our priority groups, we should have nearly half of the adults in the district who don't fall into those priority groups. An individual, again, does not have to go to their healthcare provider, does not have to get any documentation of their health condition. They attest to that health condition during the registration process. You all are fully aware that the essential worker burden for vaccination in the district is disproportionately high to any other jurisdiction. And so one of the ways that we have to ensure that we are not vaccinating residents from other jurisdictions who don't actually have an essential job in the District of Columbia is to ask for some type of proof for that. So a paycheck, a pay stub, a work ID, any of those things will suffice. And again, as I mentioned, these things do not result in people being turned away at the appointment, but people are highly encouraged to produce these documents. You could imagine that if we had a clinic and there were essential workers there and it was disproportionate to what was expected, then we would have more people enforcing or looking for this type of documentation.
Okay, and so along those lines, can you tell us just kind of where we stand as far as DC and Maryland residents? Do you have any plans to ask Maryland and DC, or Maryland and Virginia for more doses? And what percentage of the doses now are being allocated, reserved specifically for DC residents versus out-of-state residents?
So that answer is close to 90% of the vaccine that we have now. And the way to think about that is that our 65 and older and 18 to 64 qualifying medical conditions are solely for residents of the District of Columbia. Essential workers who work in the district, regardless of their home state of residence, are eligible. Of the appointments that we mentioned to you, the 13,000 appointments that are going to be going out to individuals, 10% of those will go to the category that includes essential workers that are not in priority zip codes. So that's the low number of appointments that are going or have the potential to go out to non-DC residents on the portal. Now, we have some special initiatives where closed pods are still being operated. For example, our healthcare worker pods, our fire and EMS services, the Metropolitan Police Department, and other district government agency workers at the Department of Corrections, Human Services, et cetera, are eligible, and their employees who don't live here but work here can be vaccinated in the district.
Could I ask about the parking meters? Is there any, can you give us any ballpark number on how much revenue the district has lost from not enforcing meters for a year, either from meter revenue or ticket revenue? And then can you just kind of tell people why you're starting to enforce this again?
Well, let me tell you why we had to suspend enforcement. We had to suspend enforcement, Mark, because our workers, throughout this pandemic, we had to make some choices on what activity was absolutely necessary for DC government workers. And packing into vans to be dispatched throughout the district, we decided was not an essential activity for them. And we know that it has been a way to keep more of our DPW workers healthy and able to do their work. We also looked at the level of activity in the city. Many people, for a period of time on various stages of lockdown, less traffic, and it was just frankly less need for enforcement. Over the months, we have seen kind of the parking problems evolve in some residential areas, but also commercial loading. And now that all of our schools are operational, we see problems in schools. And so you should consider this a phase where we are getting more of our employees back. We have more to enforce because there's more activity in the city, and we will continue that ramp up.
Any estimate on the revenue that was lost?
I don't, I'm sure I can get that for you. I just don't have it off the top. Yes, sir.
So,
Going back to my previous question about the seniors, I just wanted to get some clarification. So I think the number was 5,400 vaccines that were reserved this week for seniors, and it looks like we have about more than 2,600 who have registered so far. I know you guys said you're continuing to sign them up, but what will happen to those appointments this week if you don't fill up that number of seniors?
We will. We'll fill it up because people are going to get registered.
And would there be a cutoff date for when you would need to
Yeah,
fill up?
so as the
cutoff
mayor
is
mentioned,
tonight.
11:59 tonight. Anyone who's registered by 11:59 tonight will be selected. And just so we have some clarity around it, vaccinating seniors is extremely important to us. So we really do want people to use all of their resources and communicate to seniors to get registered, to help them with getting registered either through vaccinate.dc.gov or the call center at 3830-333. We want people to use those phone numbers to actually register people as well, and they have the option of getting a call back versus an email when it's time to select their appointment. If we don't have 5,400 seniors who register for an appointment today, then we go to the next highest risk group for severe disease from COVID, which would be 18 to 64, and those in priority zip codes. But we are optimistic that people will get the 5,400 seniors registered this week.
Okay.
Yes, Sam?
For Dr. Nesbitt, or maybe the mayor, I just don't know. For anyone, you've talked about churches, and you listed a number of churches there. I'm just curious, how is that going in terms of, are they getting the folks that you want to?
Yes. I think we've shared with you that our goal for these are not high throughput vaccination events. They're designed for the faith community who has, and sometimes, a unique relationship with their congregants or parishioners, as well as an understanding of the community in which they serve in terms of where people may live, who may be homebound, where people may live who cite transportation challenges and being able to get to a site. So our goal for each one of these is to vaccinate 200 people per site. And that breaks out to about 100 people per day. Some people have done more than that. 140, I think, was the most we've had on a single day. Some people have done slightly less than that, around 70 or 80 when the program first kicked off. But we've vaccinated over 700 people through this initiative who may not have otherwise been engaged in the system.
Okay, so you're saying that your target was 200 a day, but you never really reached that so far?
No. It's not 200 a day. It's 200 per site, which happens over 2 days.
Over 2 days,
Correct.
so it's
So if
basically
you-
100 a day.
Yeah, if you look at the Temple of Praise in Ward 8, for example, they'll have sessions on Monday, March 15th and Tuesday, March 16th. So they typically do 200 between those 2 days, and it's 100 each day. So we've had some who've had, when we first started, they may have only gotten to 80 the first day. And then we've had some, as the program has matured, that has done over 140 in a single day.
But it's working as far as you're concerned?
Yes. And Sam, I will take the opportunity to make sure that people know, for our high priority group, the seniors, we have access to appointments in their communities that they could use if they register. So it's not necessary for someone to wait until potentially their place of worship or other venue has a special on-site clinic. They should get registered right away. It's those who are eligible. The other piece of that is that if you do happen to get a vaccine somewhere else and we send you an appointment request, you can reject or decline that appointment because you've already been vaccinated.
Mayor Bowser, a couple of off-topic questions. First of all, your reaction to some of the razor wire coming down around the Capitol?
It's a good thing, and not only the razor wire, but the blocked streets. I actually haven't driven through, but I'm going to, so I can see what remains. So we're pleased with that.
And secondly, the police department put out a video. It shows some ATVs and dirt bikes on North Capitol Street, and in one case, I guess someone on a dirt bike repeatedly fired into an SUV. And this happened mid-February. They're putting it out, hoping to try to identify. Your reaction to the fact just somebody driving north on North Capitol gets surrounded and shot up?
I'm not familiar with that video, so let me take a look at that. Okay, any other questions? Yes, sir.
On cherry blossoms, I'm just wondering, what is the plan this year? Do you know yet? I mean, we remember last year, and there were National Guard blocking the access down there. What is the plan this year as far as, will there be any restrictions as far as people being able to go down and walk around the cherry blossoms, large crowds gathering down there?
Yes,
traffic?
we do not encourage large crowds to gather at the cherry blossoms. I think the deputy mayor represented me with the Cherry Blossom Festival, and the Cherry Blossom Festival team has produced a wonderful way to enjoy the cherry blossoms virtually, and we continue to recommend that people do it. MPD and the United States Park Police will work together to manage movements there. I've also reminded our team who is reaching out to the fresh food markets, the fish market as well, who will continue to be able to operate under the waiver agreements that they have with us. So as we get into warm weather, we are certainly thinking about the things that kept us safer last spring, and we will continue to rely on them.
So right now, there's no plans to restrict pedestrian access down there or to limit
I
it?
didn't say that.
Okay, well, could you clarify that?
I can't right now because I don't know all of the pedestrian access points. So we will announce it soon. Thank you, everybody.